Coding is kind of like detective work in a lot of ways.
A coder is a storyteller. We read a patient's medical records, read the diagnosis, procedures, and tell the story of a patient's stay.
Coding is a really important part of the hospital system because it tries to assign accurate diagnosis and procedure codes to encounters for patients that come in so that they can be correctly billed, they can be correctly tracked for disease processes and illnesses, and that can help better improve the quality of care.
The second piece of where the codes are used is for the creation of a database that allows for research and statistical purposes.
Some of us code x-rays, some of us code short-stay surgeries, some of us code inpatient charts. Everybody has kind of their specialty.
I work with a team that sits at 3 different facilities and also works from home remotely. And throughout Intermountain Healthcare, we have coders sitting at multiple facilities that will help other facilities throughout the corporation. There is a daily pressure to work quickly and efficiently, to process information quickly and assign the most appropriate codes.
One of the most challenging things that we face as coders is trying to interpret the information that the doctors give us. We have to decipher their handwriting, which can be very tricky.
If you're coding to get the bill paid, there's very FBI legal actions that can be taken if you're coding to get the bill paid.
If we don't assign the correct codes the first time, it can need to be reprocessed. To do it right the first time saves time and money.
One of the benefits we have within Intermountain Healthcare is that our coders work as a team, and we have a lot of resources, trainers, and compliance experts within coding that can help us answer all those questions if we have difficult cases to code.
To be a good coder, you need to be detail-oriented, self-motivated. You have to like to read, as you read a lot.
Many times what's appealing for coders is the ability to work within healthcare, but not necessarily within the patient care aspect.
I get to be a part of their care, but not actually do all the work, not be in the squishy parts and the blood.
The computer-assisted coding should help with productivity, but it will never eliminate the need for coders. There'll always be a need for coders to review what the computer has assigned and to assess the accuracy of those codes and the completeness of the codes assigned through the computer system.
The different changes in coding make it more of a challenge, but I'm excited for those changes, and I think all of us look forward to having more people join us to do this job.
As you consider a coding profession, investigate the work environment you are most interested in pursuing. Different work settings require different coding certifications. Information about each certification can be found on the American Health Information Management Association and the American Academy of Professional Coders websites. For example, to be qualified for hospital coding, a CCA certification obtained through AHIMA is the minimum requirement. Advanced coding opportunities can be achieved with additional experience and education.
I really enjoy that as a coder, I've been able to learn so much about different things that I had no knowledge of before. I have a better understanding of how the body works.
The part about my job that I enjoy the most is the opportunities that I get to teach new coders how to do the job that we do every day.
Working for Intermountain includes options for benefit participation, including health and dental benefits, continuing education through our Education Assistance Program, and a 401k plan to help prepare for the future. Each employee assists Intermountain Healthcare in fulfilling its mission of providing excellent care to the members of our community. Help us build an environment where physicians and employees can deliver the best in medicine.
I love working for Intermountain Healthcare. The benefits, nice PTO. I am recognized for what I do.
I enjoy the opportunity I have with Intermountain Healthcare to play a role in people's lives, many times a role that becomes invisible to them, but nonetheless is very, very important in the healthcare industry.
I think Intermountain Healthcare's Healing for Life motto is is wonderful. I feel like it's a very good company. They take good care of their employees and are very supportive in our growth and make us be the best employees we can be.